The gentleman from Minnesota is recognized for 5 minutes on his motion to recommit.
Thank you, Mr. Speaker. My final amendment would protect important tax credits and tax breaks for middle-income families and for small businesses. It will not kill or send this bill back to committee. Will allow us to proceed with final passage should it pass. And now to the heart of what this is really all about. I thought our colleague Mike Thompson here a few minutes ago from California characterized it quite well when he said this should be called the 40th waste of taxpayers' time and money act, not an alternative to the Affordable Care Act. The fact is that the Republican opposition here is engaged in their 40th political attempt to undo the Affordable Care Act and offering us no alternatives to the time when 46 million Americans had no insurance, when health care and insurance rates were rising at a rate of 20% per year. Mr. Speaker, my colleagues, no is not a plan. No is not an answer. President Harry Truman was fond of saying, and forgive me for quoting him directly, but he used to like to say, any jackass can tear down a barn, but it takes a carpenter to build one. And I'm challenging my colleagues, are you here to tear down the barn, or are you here to build one? Mr. Speaker, I feel compelled to ask, are you really serious when you come before us here and you say you really, truly want to increase taxes on families and small businesses as this bill would do? Are you really serious when you say you want to take away from students the right to stay on their parents' insurance policy while they're trying and struggling with the difficulties of increased cost of education? The American people don't want that. What is your plan? Mr. Speaker, are you really serious when you say you want to deny people with pre-existing conditions the right to have health insurance? The American public don't want that. What is your plan? Are you really serious when you want to continue this de facto notion that women somehow, by definition, are living with pre-existing conditions and charge more for the exact same policies as men would pay for? The American people are not. What is your plan? Mr. Speaker, I ask my colleagues, are you really serious when you want to vote to eliminate free prevention care, which saves lives, which helps save cost in our medical system? The American people are not. What is your plan? Mr. Speaker, I ask my colleagues, are you really serious when you say you wanted to remove the cap on insurance companies' liabilities? The very cap that forces people with serious accidents and illnesses into bankruptcy? The American people don't want that. What is your plan? And last but not least, Mr. Speaker, are you prepared to vote to deny senior citizens the relief from the increased cost in pharmaceuticals as a result of that donut hole? The seniors in this country are not. Again, I ask you, what is your plan? Mr. Speaker, that's what's at heart here. We have had 40 attempts to repeal this bill, and we haven't seen one single plan offered forward here. This is a waste of time. Let us get serious. Let us start to show some bipartisanship, and let's start with it here today by passing my amendment. Mr. Speaker, it's no secret. The public has weighed in on this. This Congress is acknowledged by all parties and all spectrums as the most unproductive Congress in the history of this country. That's shameful. Polls show us 25 points behind cockroaches in popularity. 23 percentage points behind, what was the last one? Oh, root canals. We're just slightly ahead of Genghis Khan and the Communist Party in popularity. It's time that we put an end to this nonsense, put this Congress to work, postpone, cancel this recess. Let's put an end to this nonsense, get America working again, and get this country moving.